Welcome, everyone, to another Global Smile Foundation mission. We are grateful for your hospitality and blessed to be in your beautiful country.
You are not alone in the world. Africa, Latin America, and India. Look around you and everyone.
There are nations of songs, the poems of life.
We are different. How wonderful! In this one world we share one big smile. In this one world we are one big family. In this one world we share one big smile. We are one world nation, great endeavor.
Global Smile Foundation, more than 25 years of experience with medical and surgical missions in numerous countries in Latin America, Africa, and the Indian subcontinent.
Explore your interests.
You should share what you have.
You are not alone in this world.
You can fulfill all your dreams and longings.
We are all different.
How wonderful. In this one world we share one big smile. In this one world we are one big family. In this one world we share one big smile. We are one world nation, great endeavor.
An initial medical evaluation is our first step, and you will go through different stations. Pay attention to the process. You can help us make it faster, and this day will be beneficial for everyone. And if necessary, our translators will help us communicate. Do you speak English?
Do you speak French? A beautiful smile is simply priceless.
We will take lots of pictures. It is crucial that you follow the instructions from our doctors and photographers. These pictures will help us document your progress and improvement.
Pay attention. We will call your name to start the process.
Step 1. Nursing Station, where we will take your temperature and weigh you. Step 2. Surgeon's Evaluation. Surgeons can be playful and will have questions for you and your parents. They will ask you to open your mouth wide, to close your mouth, to smile, to be serious. And of course, they will want to take lots of pictures. Nothing will hurt you. These are some of the instruments they will use.
Flashlight, tongue depressor, long swabs, globes, big and sophisticated cameras.
Station 3. Evaluation with pediatrician and anesthesiologist. Here, our doctors will examine you to determine your state of health. They will listen to your heart, lungs, they will check your tummy, and you will be asked to open your mouth wide. This will determine if you are in good condition to receive anesthesia and undergo surgery. You are likely to see the following instruments: stethoscope, auto-ophthalmoscope, oxygen sensor, tongue depressor, gloves. Station 4. Official picture. Our professional photographer will ask you to smile, to be serious, to open and close your mouth, to look up, and by the end, you will be an expert. Station 5. Dental Station. As part of the screening process, you need to go through a dental evaluation, even if you do not qualify for surgery. The doctors will use long mirrors, suction tubes, gauze, and tongue depressors to see if you have cavities, gum trouble, or any other issue we could solve prior to your surgical treatment. Station 6. Wait. You may now go to the waiting room. We appreciate your effort to be here. Your evaluation has been completed. Once all patients are evaluated, our team will prepare the surgery schedule for the week, which we will share with you as soon as it is ready.
We hope you understand that it's not possible to operate on all patients during one mission. We are only here for a week. We select between 30 and 50 patients per mission, and as you know, we return every year to continue with our work.
If you have a cold, a cough, diarrhea, or nausea, or if your condition is accompanied by any ailments, such as heart or kidney disease that may put you at risk for surgery. If you require complex procedures or have undergone surgery before, it is possible that you will be selected on another occasion. If you are selected on this mission, pay attention to some instructions you should follow.
Adults should not eat or drink anything during the 12 hours, and children 6 hours before the time we have set for your surgery. You should take a shower the night before your surgery, making sure to wash your head and face very well. You should brush your teeth before going to bed and when you wake up the morning of your surgery.
These types of malformations happen between the 6th and 10th weeks of gestation, and there are many associated causes.
Some risk factors that can predispose a child to developing a cleft are mother's age, older than 40 years, consanguinity between parents, cousins, or relatives, maternal smoking raises the risk by 26%, taking some medications during pregnancy. Mother's malnutrition has a great influence. It is very important that the mother eats properly, receives prenatal care, and takes her folic acid and vitamins.
This condition is transmitted as an autosomal recessive trait for which the probability of having a second child will be the same condition is 25%, and having a third child with it is 50%. Frequency varies among countries. 1 of 1,000 in white Caucasians, 1 of 750 in indigenous population from Andes, 1 of 3,000 in sub-Saharan Africa born can present some type of malformation. As you can see, there are many causes and factors that could determine how you were born with a malformation, and all of them have a scientific explanation. It's natural to be anxious, sad, or nervous, but it is important that you know that these conditions are largely treatable and that you can have a normal and productive life.
Some of the functions of the lip are to suck, laugh, whistle, be the gateway for food, and protect other oral structures. The palate closes the entrance to the pharynx, preventing the passage of liquids, food, and air to the nostrils. The main function of the palate is language.
When the natural functions of the lip, nose, and palate are interrupted by a cleft, some difficulties with feeding your baby may arise.
Feeding babies with cleft lip and cleft palate. When feeding babies with only a cleft lip, it is possible to breastfeed, which is recommended, or you can feed the baby with a regular bottle, placing it on the opposite side to the defect. If the cleft is on both sides, place the bottle where it is more comfortable for your baby. In infants with a cleft palate, the baby doesn't have the ability to suck, neither from your breast or the regular bottle. For this, there are special bottles that ensure a proper feeding and the weight gain expected for your baby. Mothers wishing to feed their babies with breast milk can do so by extracting the milk manually and putting it in the special bottle. If you like to, you can also hold your baby next to your chest to support the bond with him or her and stimulate the milk production, but you should know that your baby won't be fed properly this way.
You should never cut off the bottle's tip. Use a bottle with a cross-shaped hole. Control the milk flow by gently squeezing the bottle in a way your baby can rest. The correct way to feed. Place your baby tilting him or her 45 degrees or more during the feeding. Place the bottle on the opposite side to the defect or where your baby feels most comfortable.
It is important to be aware of signs of distress during feeding, which are usually caused by a large stream of milk. Some of the distress signs are that your baby coughs frequently, that the milk spills excessively from the baby's mouth, that your baby tries to pull away from the bottle, arching his or her back or turning his or her head away, that your baby opens his or her eyes widely. Limit feedings to 30 minutes on each attempt to feed your baby, so you will avoid wearing him or her out or him or her burning more calories than necessary. It is important that you burp your baby more often. when the bottle is halfway down or with each ounce of milk that he or she takes. It is normal that when you do this, some milk will come through his or her nose, as long as it is not an excessive amount.
If you have any questions, please consult your doctor.
A beautiful smile and simply
Priceless. Global Smile Foundation. One world, one big smile. One world, one big family. One world, one big smile. One world, one endeavor. In this world we share one big smile. In this world we are one big family. In this world we share one big smile. We are the world nation great endeavor.
Being supportive year after year is our firm commitment.
Global Smile Foundation.
A beautiful smile is simply priceless.